Hello, everybody. I'd like to welcome you to episode 3 of Transformation and Strategy. And today we're going to be speaking with Dipti Purbhoo, who is the executive director of the Dorothy Ley Hospice in Toronto. She oversees residential, community-based, and integrated hospice palliative care services. She has over 20 years of experience in home and community healthcare and has held various executive leadership roles. And I can tell you from personal experience that I have seen the health system improvement strategies that she has contributed to at a provincial, regional, and also at local levels. Dipti is a registered nurse by background. She's reputable for her reputable and innovative leadership, and she has done a lot of collaborative initiatives that have enhanced integrated community healthcare. Dipti holds a master's in health administration from the University of Toronto, as well as a master's in health science in nursing from McGill University. It is my pleasure to have Dipti here speaking about transformation work happening in the palliative care sector. Welcome, Dipti. I'd like to welcome you to our third webinar. I'm so excited to hear from you about the kind of transformation that's been happening in the palliative care sector. So let's just kick it off. From a palliative care perspective, what do you think we need to focus on, in terms of really doing ongoing transformational work?
Well, first of all, Priya, thank you for the invitation to participate in your podcast and talk about one of my most favorite topics that I'm passionate about, which is hospice palliative care. In terms of, and thank you for the generous intro as well. In terms of transformation, I think that there are a number of areas. First and foremost being building broader awareness and integration of hospice palliative care earlier in people's illness, in the trajectory of illness. Too many people today don't get access to hospice palliative care because one, they don't know what it is and how it could help them. Two, and if they do get access, it's very late in their journey in terms of just weeks to months to days to live. And that a lot of that has to do with not being aware and understanding of how hospice palliative care can help, but also it's not hospice palliative care right now is not integrated into complex care and care for people with serious illness upstream in the journey. So that to me, that's the biggest transformation we could have in hospice palliative care if we integrate hospice palliative care, the palliative care approach early in people's trajectory of illness when they're diagnosed with a life-limiting or serious a terminal illness. So I think that's one of the biggest transformations that we could have. And then the second transformation, I believe, is very much around integrating palliative care. Currently, we do have, I think we have good palliative care in many parts of Ontario, but there's still silos that exist, silos between home care, hospice care, care in the hospital, and that needs to be much more integrated into an integrated one-team approach to support individuals and their families. And I think that can result in greater capacity to care for more people. And most importantly, it will improve the experiences of patients and their families with the system. Right now, they experience a very fragmented system. It's quite confusing. That in and of itself, the system and the way they have to interact with it causes burden and harm and more anxiety and stress for individuals and families who are already experiencing so much. And I also believe it'll result in better efficiencies and better outcomes for our system as well. So those are the two transformations that I would say are really important in palliative care.
It's amazing to hear you speak about being integrated further upstream rather than downstream. And as Dipti, you and I have chatted, I've actually experienced it with having a parent with extremely complex, chronic medical issues who I couldn't get eyes on from a medical perspective. And the minute someone came in from the palliative care team, it was just such a relief. So, I mean, for me, this is something that I have a personal passion about because I have experienced the stress that you mentioned. and the exhaustion that comes with knowing, and it's compassion that you need at a time like this, right? So are you thinking that the system is going towards this approach of not being reactive and taking on that earlier approach? Are you seeing it happen in practice?
I'm actually for the first time in many, many years, quite hopeful, and that's where the system is going. There is greater recognition of the importance of a palliative care approach to care. There's greater appreciation for the difference palliative care can make to the lives of individuals and their families, not just at end of life, but earlier. And I think a lot of that has to do with the pandemic. The pandemic, I think one of the silver linings is it opened the door for people to think about their own mortality, what's important in life in terms of as they're experiencing a serious illness. And COVID was, a very serious situation where people could die, and many did. And I think that just open people's perspective around thinking about what they would want for end of life for themselves, for their loved ones. And because of that greater openness, I think that there's more reception on the side of the public to start to talk about death and dying earlier. Whereas in the past, I would tell you, even now, many times it's, you're from hospice, I don't want to talk to you, or I don't want to hear the word palliative, and death and dying was not something people wanted to talk about. I am seeing more reception. I can't say it's 100%, but there is a certainly more than what it used to be. So that's on the public side. On the healthcare system and provider side, I do I do feel that there is more interest on the side of the health system, the government, and interest in palliative care. And I think that's evidenced by the recent investments that government has made. So they've invested in what are their palliative care clinical coaching program through the implementation of the Ontario Palliative Care Health Service Delivery Framework for palliative care. And the government, in terms of the regional body, the Ontario Palliative Care Network, has put out frameworks that they've co-developed with healthcare providers around what a model of care should look like for palliative care across the health system. For the community, they've just put one out for the hospital, and more recently around pediatrics. And then I'm seeing investment to follow through on implementation of those models. And to me, that gives me a lot of, I feel hopeful that, we're going to start to see the tide shift, because it is a big shift. It's a shift in public thinking, and also health provider thinking, and then health system thinking around the benefit of a palliative approach as early as possible in the system. The third thing that makes me very excited and hopeful about is, and this is, and if you're looking for, these are guests that I would recommend on your podcast, because they are truly blazing a revolutionary trail. They are doctors Sammy Winemaker and Dr. Cian Xiao, who are the co-creators of the Waiting Room Revolution. And they have published a book called Hope for the Best and Plan for the Rest. And this book is all about getting the public, empowering patients and families, and getting the public to think differently, or be empowered if they have a serious illness, or their loved one has a serious illness, for them to have the knowledge and information about what their care journey, how they want their care journey to go, and equipping them with the tools, the questions, the things to think about, the plans to make in terms of interacting with the health system, organizing their own supports around themselves, thinking about what they want for themselves and their families as they navigate through this serious illness journey. It truly is revolutionary. They have 7 keys that they talk about in the book, where they want people to have hope for the best in terms of their illness, but plan for the rest in terms of if their illness continues to decline and they move into end of life. So I find that book tremendously transformational. And I think that there's a significant reception for those ideas, those concepts. It's very much about the palliative approach integrating it early into care. But the work that they're doing is they're empowering the individual and their family to have the knowledge in terms of how to ask for that approach, how to integrate that approach themselves into their care. So when I think about you talking about your mom, Priya, I would say if you had this book, I would tell you it would have been such a guide for you in terms of how to navigate this process as best as you can. Right now, there are organizations like ours at the Dorothy Ley Hospice where we have staff who, we work with patients and families to help them navigate the system, help them ask the right questions, think about what they need, think about what supports they need, think about help them interact with the health system and health services so that those services are meeting their needs and are aligned to their goals and wishes. And so to me, I'm super excited about that. I feel so hopeful and so inspired that truly there is going to be this revolution really in terms of thinking around palliative care and integrating that upstream and integrating it into our health system.
I do wish I had read that book a while back, and it does sound like one that absolutely I'm going to pick up and read because I still have friends of my parents who have since passed on calling me for advice because they think I know how to navigate the healthcare system. And having been in the system, I still found it extremely challenging. So when I listen to you, you talk about hope and you talk about the public and the system side, it sounds like finally there is some kind of synergy happening at both levels. And speaking about public, it's almost like I'm hearing of a bit of a mindset shift that you saw post-COVID. Are you finding that, we have a very diverse community in the Greater Toronto Area, which is where you're based. Are you finding that there is equitable access to hospice and palliative care? Like, what is some work that you think is needed if that's not happening?
Yeah, that's a great question, Priya, and I think that's another area of important work. I think that shift that I'm seeing, I think it is certainly in the broader community, and I think individuals with that are from different backgrounds, different diverse backgrounds, cultural backgrounds. We have not done enough work in palliative care to support those communities. The essence of the palliative care approach is truly uh, seeing the person for who they are and supporting them with their serious illness and into end of life to be able to have as much dignity, as much comfort, but also to live their life the way they want as they move forward with their illness. And the goal of the health system is and palliative care is to support them to do that with the health services that they need to be able to do that. And I think with individuals who come from different cultural and diverse backgrounds, I think as a health system, we have to do more to understand what their needs are, what their interpretations of death and dying are, and palliative is. I know that in my culture, you don't talk about death and dying. It's called the evil eye, right? Like it's almost like the evil eye concept, where if you talk about it, you're bringing it on. So don't talk about it.
Yeah.
And so to start to talk about these kinds of concepts earlier, I think would be would be harder in my community, for example, and certainly with my older relatives. However, reframing that conversation to talk about,
Mm.
what's important to you. If you did get sick, what would you want? And supporting that conversation quite differently. I think there's some education that needs to be done too in terms of what palliative care truly is and how it can be helpful. So again, I'll take an example from my own family. I know that in my family, particularly with my older family members, the culture basically is, when you're sick, you go to the doctor and they fix you, right? And the idea of saying, well, you have a serious illness that's not going to be fixed and you should get other types of care would be very hard to receive. And so that requires some education. And I've had to do that with my own family to say, there's going to be a time when the doctors aren't going to be able to fix things. What would you want? Oh, well, I don't want to be bedridden. I don't want to, lose my ability to see my friends or do these things. And I said, okay, so let's talk about that, right? So it is educating different diverse groups and cultural groups about what palliative care is, understanding their beliefs around death and dying, and what biases they might have or misinformation, and trying to really support them. And I think that work is important work. And there are many people currently who don't get access to palliative care simply because they don't understand what it is.
Or they don't know,
Or they
right?
don't know. They don't
Yeah,
even know that this kind of a service exists. I
that's
have many people when I talk about the hospice and we deliver hospice care in our residence where we have 12 beds. They're like, "Is it free? Oh, you did that?" And I said, "Yes, it is." And they had no idea that that
Mhm.
kind of home-like environment for end of life even existed, or that it could be available for them, right? They thought they'd have to pay for it. I mean, these are just simple things, but people don't know. Also, I think it's about services, hospice palliative care services being in communities, right? So here in Toronto, we serve the West Toronto and Etobicoke area. There is very little hospice palliative care services in North Etobicoke, and we know that.
Mhm.
And our funding model is such that with hospice services, we have to fundraise. We do get government funding, but we also have to fundraise. So we fundraise about 40% of what we need to operate our services. And, we have wonderful donors and a wonderful donor community who mostly is based out here in Central Etobicoke and West Toronto. And it's difficult to grow our services enough to serve the North Etobicoke community. And because it's just, we rely on donations. Even our residential hospice is located in South Etobicoke near the lake. We have many, many people who live in Rexdale and other places who,
Right.
for them to even have a family, if they had a loved one here, I mean, we had an individual here whose wife wanted to visit every day, but she couldn't afford the travel, and she didn't have a car, and she wanted to be at the bedside. It's those kinds of issues from a social determinants of health issue in terms of access that we also need to consider. And if you look across Ontario, it would be interesting to kind of map out where are the palliative care services. And in fact, in our Toronto region, our Ontario Health Toronto colleagues are doing that. And you could see large gaps of services, palliative care services in communities that are more marginalized and with minority communities, populations. And so it is something to be focused on. And this is also what makes me hopeful. I think this is a very hopeful time in palliative care at the moment, is even with the new funding that is coming forward around palliative care, there is a focus on addressing equity and equity deserving communities. And so one example is recently the government announced 79 new hospice residential beds. And specifically, they were looking to fund those in equity deserving communities where access was a challenge and an issue, Indigenous communities. And there is going to be a new 5-bed Indigenous Indigenous developed hospice, the first of its kind in Canada, right here in Ontario and Brantford, that the government invested in. So again, I'm very hopeful that the investments that are coming, there is an equity focus to it in terms of ensuring that everyone gets access. In fact, that's our vision right now. Everyone receives access to exceptional hospice care. And I'm starting to see that the government is also integrating that priority into the funding that they're providing.
I think that you really hit upon some key points is what is the role of community leaders? You demonstrated with your own family, your own culture, and also you spoke about the need for marginalized communities to not only have the knowledge and the tools through, things like the book that you mentioned earlier, but access. Do you think that if that actually did happen, that people were educated, they were informed, and you start to see a mindset shift and a culture shift, is the palliative care system set up to support all of these individuals?
No, we need more services, right? And I think that's where the ongoing investment is needed, right? If you think about the number of people who could benefit from palliative care, it's significant. And I think part of that is more investment, and part of that is also capacity building in other parts of the healthcare system. And this is where palliative care is an approach to care, right? And it can be done by palliative experts and specialists and others, but it's also an approach to care that could be integrated into the care for frail, complex seniors, right? By
Yes.
family doctors, by community agencies who are caring for people. It doesn't have to be done by specialists, but
Mhm.
I think there is a need for organizations like mine or others who can be there to be the trainers, to be the supports,
Right.
to be of assistance when there is a complex issue. But I think we need to build capacity across the healthcare system in all providers, particularly those that are caring for complex populations, to be able to support a palliative approach to care at the
Mhm.
basic level. And when they need more help, that's when you have a specialist organization or team or partner who can do the assistance. And I think that's where, I had a colleague in the palliative care world, Dr. Denise Marshall, who talked about the fact that palliative care is a public health issue, right? Because it's an approach to care, a way of living, a way of living with serious illness and dying that is based on the individual having responsibility, the community having some responsibility
Mhm.
and knowledge, and in our case, also the health system, but the health system not um, everyone in the health care system, not just, a group of professionals that are experts in palliative care. And so we are doing some of that type of capacity building. We've been
Mhm.
working with a lot of the community health centers, so Rexdale Community Health Center, LAMP, are some of our community support agencies, like Etobicoke Services for Seniors, where we're going and teaching them, their staff, about when to identify, a little bit about grief and bereavement so that they
Right.
can provide some grief and bereavement support to their individuals, talking about advanced care planning. And so trying to equip them more with some knowledge and information, and then accessing our support if needed. The recently introduced program by the Ontario Palliative Care Network around the palliative care clinical coaches. These are
Mhm.
palliative care either nurses, social workers, or nurse practitioners who are going to train other community organizations and family physicians and others around palliative care. So they can identify people who need palliative care. They can provide some palliative care to people, and then know where to go to get help,
True. True.
right? And
Yeah.
so I think that that's a really important piece. The demand for palliative care is going to grow as our aging population
Absolutely.
grows, as more people start to understand what it is and what
Mhm.
value it can bring.
Mhm.
And so our system needs to be set up to, I think we do need more formal palliative care services, more hospices, more, palliative services at home. But we also then need to build capacity in the rest of the healthcare system to be able to deliver some of that support as well.
Yeah, it's almost like you have tiered levels of intervention, right? And when you talk about working with frail elderly, complex care, chronic care, it's about starting early. So it really sounds like, and I happen to know about the program you're doing with ESS,
Yes.
the hospice at home program. So, I know that that has been really well received. So it gives me hope because I did not have the best experience on this journey myself. And so it does give me hope. Speaking about hope, and it sounds to me like that central theme for you, for yourself, and for your teams. This is hard work. I mean, we hear about the impact of death and dying, not just on family members and caregivers, which what your team is, and you also are a caregiver. How do you kind of move through that journey and continue to fill your own bucket? Like, what is your advice to others who are kind of young in this arena, and kind of any leadership lessons you would like to share?
Yeah, I think this work can be hard in terms of from an emotional perspective. But I think when I speak for myself and many of the staff who work in this field, it's incredibly rewarding, right?
Mm.
I've done so many different things in my throughout my career, but I have to say that this work is so rewarding. The impact you make in the lives of an individual and their family, where the support we offer and the care we offer makes that journey to end of life and even after into bereavement for those that are the family members and friends a little easier, a lot more support and more supported,
Mhm.
a little bit less scary, and with a lot more compassion. And I think that is just so incredibly rewarding. We do we have processions here when someone at the residence when someone passes, when the funeral home comes for the body, as they're taking them out, we have a beautiful quilt that we put on top, and the family members will walk behind, and so will all the staff. And we gather at the front of our hospice. There's families light candles. We say a few words. Sometimes there's music, there's prayers. And I remember we had one of the processions, and it was for a woman who turned 60 with us. She had her 60th birthday with us. She had her 30th anniversary with us as well, with her husband. And she had two kids, and she was dying. She had died of cancer, and her two girls were probably 20 in their 20s. And there was such love. They were here with us about 6 weeks, and they had a beautiful anniversary party and a beautiful birthday for her. And there was so much love in this family. And at the procession, the husband and the daughters just said, thank you so much to all of you, because this was very difficult for us, and you made it easier. And in fact, the daughter is this young daughter of 22 or however, she said, losing my mom with cancer was the hardest thing in the world, is the hardest thing in the world, but you made it a little bit easier. We felt loved and cared for. And that reward, that belief, that knowing that you're making that kind of an impact to people is tremendous. And I think we feel it every day, and my staff feel it. And that gives us a lot of energy to continue to do this work. Having said that, it can be hard. It can be very, very difficult, especially when we see younger people at the hospice pass away. It's very hard. And, we do a lot of work here to practice what we preach. Are we always very good at it? Probably not, but a lot of the hospice palliative care philosophy is about comfort, taking care of yourself, your well-being, not just the individual, but the family. And we have a lot of services that cater to that in terms of wellness services, which are complementary therapies like Reiki, therapeutic touch. We teach meditation. We teach, other ways to kind of manage stress and anxiety. And so we do that here at the hospice. On Thursdays, we have someone who comes in, does yoga and meditation. We take meditation breaks and other things. So we really try to encourage the staff and really to practice what they preach in terms of some of the tools that they teach, to actually use that for themselves to kind of maintain their well-being. But it is tremendously rewarding work, and I think that's what sustains all of us. And I think, leadership lesson, what would I say? I would say, and I have the wonderful opportunity to meet with many young people who are
Mhm.
just starting out in their healthcare careers and thinking about leadership. And I always say, try to find something that you're truly passionate about, that gives you purpose and meaning. And I think that's really important. That would be my leadership lesson, is try to find purpose and meaning in what you're doing,
Mhm.
so that it can sustain you. It allows you to bring your best. It allows you to be your best, give your best. And so, yeah, that would be, I think, the leadership lesson that I would share.
That's fantastic. And also take care of yourself is what I heard.
Agree. Take care of yourself.
Focus on self-care, and because I think a lot of people join the healthcare field because they want to make a difference.
Yeah,
And it comes from the heart. And,
absolutely.
we know that many of the staff that are delivering direct care may not be reimbursed at a rate that may feel like it's, equitable from their perspective. So I think that you're really speaking about, like, what do you enjoy? What do you feel is making a difference? So thank you. Those
Agree.
are really powerful words.
Yeah, and I really think that taking care of yourself is really important, right? And I think
Mhm.
many of us learned that a little bit in the pandemic with the increase in mental health and
Right.
challenges, the need to take care of ourselves so that we can take care of others, right? I think we
Sure.
preach it and we talk about it
Mhm.
in healthcare, but we need to, as leaders, do that ourselves and role model that and support our staff to be able to do that as well.
Caring for caregivers,
Absolutely.
right? That's and everybody in the work is in the field is a caregiver, so that's
Yes.
certainly true. Let's talk about you. I
Okay.
want to hear about your superpower. Like what has brought you down this we heard your intro and it's quite amazing in terms of the impact you've had and the journey you've had. Like what is your superpower? Tell us a little bit about your journey.
I think my superpower, I don't know if I have a superpower, but I think it goes back to my comment just to your earlier question around purpose and how do you take care of yourself and how you sustain yourself in this work. And for me, I think it's this I've always had this real deep passion for helping people, making things better, and having an impact in people's lives. And I think that is what sustains me is having that impact and doing work that actually has that impact, working with people that has that impact.
Mhm.
That is what really sustains me. And I have this deep passion, right? Like I wake up every morning and I have this burning desire to say there's still so much to do in our healthcare system. I'm not talking just palliative, I'm talking our healthcare system. There's just so much to do to make things better. And I wake up with that burning sense of urgency that, we've got to get at it because there's so much to do. And I think that deep belief that people deserve good care, that people deserve to be helped is what I think it just influences everything I do, right? That's what I feel keeps me energized and keeps me creative and keeps me thinking about new ways of doing things. So maybe that's a superpower. I don't know if I've answered that question well enough, but that's what I would say. I guess in terms of my journey, I too I'm a nurse by background, and I went into nursing. It was either nursing or social work. But I went into nursing because I wanted to help people, obviously, and I wanted to do work that was meaningful. And then when I moved here, I grew up in Montreal and I did my nursing there. But when I moved to Ontario, I had the good fortune to start my work at the Community Care Access Center in Toronto, or the CCAC in home many
CACs.
years
Ooh,
ago. I was a care coordinator.
mean blast from the past
A
there,
blast
Dipti.
for the past, yes. I was a care coordinator working
Oh,
in
wow.
Jamestown, which is a very underserved community, a beautiful community actually, with people who are living in boarding homes and living
Mm.
in, many, many newcomers. And then you also have Cabbagetown across the street in that community where there are $1 million homes. Just a beautiful, lovely community. And I fell in love with home care and community care work. And that's where I truly appreciated community care. And I've always worked in community care. And then I also worked as a care coordinator with people in that community. At that time, when I started back in the late 90s, mid 90s, there were a lot of people dying of HIV and AIDS. And so I
Mm.
worked with Casey House at that time quite closely, Philip Aziz quite closely as a care coordinator. And that, just really started my interest and desire around palliative care. And then at the CCAC, had the opportunity to be the manager of palliative program and just continue to do more work around palliative care. And I had the good fortune also to work with incredible leaders at the CCAC. I always thank my lucky stars for ending up there. I got to work with incredible health system leaders like Camille Orridge and Stacy
Mm.
Dobb. Camille went on to she was the CEO of the Toronto CCAC and then the CEO of the Toronto Central LHIN. As you know, she's a ardent health equity advocate and just
Yes.
incredible, leader in the health system who's done tremendous work. I just thank my, lucky stars that I got to work with her and learn from her about what true leadership is, and what we need to do as leaders to make a difference to our community. And then Stacey Daub, who I work with as well, who's now the CEO of Quinty Healthcare. Again, just what Stacey taught me was always to believe that things can be better, and look at many, just being very creative and different options. So I'm really thankful for those opportunities. And those are just two. I mean, there are so many more that I've had the opportunity and good fortune, including many hospital CEOs that I got to work with in my executive leadership role at the CCAC, in terms of just learning from them. And what I learned from those leaders was when you are a leader, you really have an important responsibility to put your staff first, people first, in terms of not just your staff, the community, the broader public first, and think about how you can be in service of them in your role, and what you could do to influence change, not only within your organization, but across your organizations. I also learned how collaboration is important, that leadership is not about one person. It's about mobilizing your organization, but it's also about partnering with other leaders in the health system, bringing people together to do more together. And that's something that I love to do as well, and I love to interact with. So many of we at the hospice we don't do this work on our own. We have many partners, and a lot of the incredible initiatives that we're doing is because of partnerships with our other leaders in the system. So with the Etobicoke Services for Seniors and Alison Koch, who's the CEO there, our hospice at home with Humber River Health, and the wonderful Vice President VP there, Beatrice Edelstein, our amazing work that we're doing with the Mississauga Ontario Health Team on creating integrated care with the Hospice Mississauga leader, Katrina Fex, and our OHT leader, Lindsay Wingham Smith. So it's leaders, right? Like it's
Right.
that it's bringing leadership is also about bringing other people together in a shared vision and a common purpose, and so that you can have greater impact. You can have collective impact to make change and make things better for people in the community. So those are some of the things that I have been very
Wow.
fortunate to learn along the way. And I honestly, again, I don't know, just thank my lucky stars for the opportunities that I've had to learn from the incredible leaders that I've had to work with in my career in the past and currently. I learn each and every day from them. So
Wow, Dipti, I'm just, as I'm listening to you, if you could see my hand here, I have like gooseflesh, because what I'm hearing is the profound impact that others have made on your journey. And what I see is the profound impact that you are making in your collaborative work with partners now. And you did mention that there have been so many along your journey, and thank you for doing that call out to some of the leaders who I happen to know a few of them, not as many as you. So do you see yourself being one of those profound leaders that'll help others?
listen, I don't believe I'm not leadership, I find it's not about a title. It's
Mm,
actually about making a difference, right? And I believe there's leadership everywhere, at every level. And honestly, I see it in the hospice. I have these incredible volunteers who are leaders in their community. They were leaders, community volunteers who were the leaders who created this hospice many, many years ago, that started 30 years ago. In terms of myself as a leader, I feel that, I believe that I can help others be their best. I can help others, support others to achieve their goals. And if that's the definition of leadership, then yes, I would consider, that is something that I enjoy doing, is supporting people to thrive and to be their best, to make a bigger impact, to support them in whatever way I can to be able to do that.
As we wrap up our chat, Dipti, and I want to thank you for taking the time, I think the one thing I would ask you to end with is if there is a family that's impacted by, end of life care, and they come from a place where they are used to taking that family member or the person they're caring for to the hospital for that care, what would be your message to them, just to kind of, say that there is other support you can get that can really wrap around you and be meaningful and bring that dignity that folks are looking for, including the empathetic care and support?
Yeah, so I think it starts by what I would say is, what palliative care is. I would try to explain that, there are palliative care, there is help out there to help you and your loved one during this end of life journey, right? And that help is called is our services called palliative care services, but that those services are geared to helping your loved one be as comfortable as they possibly can, to do the things that they would still want to do and that are meaningful for them as they're approaching end of life. So live as much as possible, with as much quality of life as possible, and that there's help for you as a caregiver to help you understand what's happening, what you could do to help, how to care for yourself. And then there's actually practical help. There are people who will help you in the home if you need care, physical care for your loved one, in terms of taking care of themselves and personal care activities like bathing and dressing and feeding and toileting. And there's medical care help that could come into the home as well. And so you don't have to seek care in the hospital for those things. Reach out to the local hospice, reach out, ask your hospital about care that can be at home instead. So those are the things that I would say. And I would say, I would leave people with what is palliative care. And I don't think I've defined it in this discussion that we've had. And truly, palliative care is an approach. And I always define it in 4 ways. It's an approach that focuses on not curative, but actually supporting people to manage their symptoms, physical symptoms like pain. And it is focused on bringing comfort. It is focused on allowing quality of life and allowing the individual to do what they love and enjoy to do. It's also there not just for the person, but for the family, whoever that family is and whoever they call family, in terms of supporting them to know what to do and how to support themselves. The third thing is palliative care is there right from the beginning of when someone's diagnosed with a life-limiting illness to the end, and even afterwards, in terms of grief and bereavement support. And then finally, palliative care addresses holistically. It's not just about the pain. It's not just about the medical. It's really about looking at the emotional well-being, the spiritual well-being of the individual and the family. So that's what I would say is palliative care. And when you tell people what palliative care is, most people say that's what I want. And so, yeah, I think it starts with education. I think we need to do more education and help people understand what it is in simple ways and make access to care and service easier and make sure that those services are available in their community.
Thank you so much, Dipti, for a wonderful conversation. And I think we've started the conversations of doing that. Both of us come from cultures where death and dying are difficult. And so I want to thank you for the profound discussion we've had. And I look forward to hearing about how this podcast has an impact on you.
Great.
Thank you.
Thank you so much for the opportunity, Priya.
My pleasure.